We are live, and we are going to be going fully live with your questions in just a little bit, but we are live right now. So feel free to say hello.
I know.
Awkward pause.
I'm Kevin from Alita. How are you?
I was just like,
Facing which one?
like all of the audience.
So we can see that.
Yeah, she's in the golden class. If you see somebody her shoulders are going.
I got a phone call on myself.
Yeah.
That's a good position.
And then
Like this?
Am I sitting like okay with my? We're not live, are we?
Yes, we are live.
Hi, Facebook world. Is anyone following or watching yet?
Not yet.
Everyone should log on to their Facebook right now.
Right now.
Do you want to stream it?
Can you do that?
Right now. Right now.
Yeah, go ahead. You can be doing it from your chairs.
Right, that way it looks like we're
so used to it.
popular.
Well, they're hearing that. So you are live right now, just so you know. You are live.
People can hear Michelle's not.
Yeah, people can.
Michelle, right?
People are listening right now.
Log in. Take a selfie.
There you go.
We are live, you guys. Oh, Kristen Godbout just commented.
Hi, Kristen. Hi, Kristen.
We've got Nancy just joined.
Oh, Nancy.
Yeah. And Kristen says, sit down, Michelle, sit down.
I am sitting. Oh.
All right, it is 7 o'clock. Are we ready to get this party started?
Yeah.
Yes.
Do it.
All right, Julia, come on out.
Good evening. My name is Julia Thurman, and
Get in front of us.
okay. Good evening. My name is Julia Thurman, and I'm the practice administrator for the Center for Skin Wellness. So first, I'd like to thank all of you for joining us tonight here in our office and on Facebook. With us this evening, we have Dr. Robert Finkelstein, Michelle Isaacs, nurse practitioner, and Monica Jandera, our licensed medical esthetician.
You can see it right in front.
There you go.
So this evening we're here to answer your questions about medical and cosmetic dermatology, as well as any aesthetic questions that you might have. We're first going to take questions from our audience, and then going forth, it's like if you have questions from home, feel free to message those to us, and we will answer as many as we can.
And Joan Jones says hello, so she's
Hi,
Hello.
Joan.
Okay. You're welcome to go ahead and ask your first question.
Go ahead, anyone raise your hand. Go ahead.
I'm not shy.
Kevin.
I have some concerns of being a male. What's the best way of me, keeping my skin and maintaining my skin? What can I do?
Well, I guess since I'm the male, I'll answer a question, but I'll have Monica help me out with that too. So the best way for everybody, not male or female, is sun protection, prevention, right? Because what ages our skin the most is the sun. Time also, but sun especially. So sunblock is really important and paramount. Protecting your skin with antioxidants and using like a maintenance of products at home is also important. Procedures work, but if you don't do daily regimens, which Monica can talk to you about, and doing some procedures like ranging from really what you want, what your goals are for fine lines and wrinkles. Botox is something that a lot of men are doing more and more of. Fillers, a lot of men are doing more and more of. So it's prevention, it's daily regimen, and then treatments. And then Monica can go into like a little bit more about like what you can do.
So forth, maintenance.
Right. Maintenance as far as like daily regimen. Yeah, and doing procedures that kind of keep up with, so try to slow the progress of time.
Absolutely.
Yeah, a good skincare regimen would be on a good cleanser, a good toner that helps to restore your pH levels of your skin, being on a good exfoliator to remove all the dead skin cells. If you're over the age of 40, you should be using a product that's going to help stimulate that cell turnover, which helps with collagen production. Definitely an eye cream that sometimes gets forgotten about, but to be preserving the skin underneath the eye is a good way. Just your basics, and then there's other products that you can include that's going to help address
we have a question online, and the question is, how many times a year should you get your skin checked for cancer?
Okay, I'll take that one. So usually it kind of depends on your history or your family history. On average, we usually like patients to come in at least once a year for a good head-to-toe skin check. If patients have any history of melanomas, we usually bring them in sooner on a regimen throughout the year. And then also if they have non-melanomas, we try to get them in more than once a year and have them in the practice doing treatments to help prevent further skin cancers or pre-skin cancers. I don't know if you want to add anything.
Yeah, I mean, there's no cutoff like some like colonoscopy at age 50, things like that. It really depends on the person, how much sun exposure they've had in their lifetime, and genetics. I mean, that is really what it comes down to. So it's really tailored to the person. There's no like, well, you need to come in at age 40 at this time. But again, if they've had skin cancers or a lot of sun exposures, then come in at least once a year, and more so if they've had treatments.
Another thing to add to that too, I would say, is a lot of times we tell our patients to do their own self-skin checks at home, so that way they can be on the lookout for what is normal and what they're used to seeing, and make them accountable for seeing any changes. So even if we say, okay, everything looks good, come back in a year, if they notice something's changing, then obviously we want them to come back before that year is over. Next question.
I have a question.
Yes.
So I've heard a lot about fillers and I'm getting older. So how do I know which kind of filler to choose for my skin type? I know there's so many out there. How would I go about that?
Yes, there are a lot of different fillers. Primarily, it's individualized. So I have a lot of patients who come in for consults for fillers, for Botox, different skincare products, and they like to say, you know, my friend or my neighbor has done X, Y, and Z. I want to do the same thing. We're all different. We age differently. It depends on the individual. So there's an array of fillers. A lot of times we like to use fillers that are hyaluronic acids or HAs, which help to bring in water and kind of plump and add volume to the skin. So depending on the aging process, sorry, we have people in the office, so I was addressing the question that way. But depending on the area that we're looking at in the patient, sometimes we like to add more volumization to the cheeks before we address the lower face. Sometimes it's a patient who's a little bit younger, who may not need as much volume in their cheeks and they just want a little lip plumping or a little bit of filler under the eyes for the dark circles and fat loss under there. We call it tear troughs. So it really just depends. I think the best thing to do is come into the office for a consult so we can meet your individual needs, go over your concerns, look at photographs, and go from there.
So we have another question from online. It said, as a new patient, how long would it take to come in for an appointment as a new patient?
We are taking new patients, and all I can say is call, and you will get in. We'll get you in quickly. We're in season, so call and we'll get you in.
Talk to me about hyperpigmentation and how you would treat it specifically in skin with more melanin.
Yeah.
Repeat the question.
The question is, how do you treat pigmentation, especially with people that have more melanin?
Yes.
So darker skin has to be treated a little bit differently. Not everybody who has pigmentation should be treated the same. So the first thing is to find out what the underlying cause of the pigmentation is. So if it's, for instance, if it's melasma, which is also called mask of pregnancy, if it's hormone induced, we use different things to help with that. Like there are creams, prescription creams that have bleaching agents in them. There's other we call hydroquinones that we use, which Monica can talk a little bit more about. Also, for instance, people have pigmentation from inflammation. So if they have acne, for instance, or rashes, they develop pigmentation. So you have to address what's causing the inflammation before you address the pigmentation. So it's not just one size fits all. Chemicals generally work better on darker skin types rather than mechanical treatments. So mechanical treatments can actually cause pigmentation. We don't want to use that. We want to use a little bit more gentle. And then the final thing is sun protection. That's ultimately, no matter what, even in darker skin, sun can bring out pigmentation. So it's really important for us to educate, and that's like first and foremost, to educate the patient on how to kind of prevent and maintain their pigment. And Monica can go over a little bit more about the treatments.
Yeah, the different treatments that we offer are chemical peels that we do here that helps treat the pigmentation, hyperpigmentation, melasma, being on a good skincare kit that utilizes a different variety of products. It's not just one bottle. It usually does take a series of products to achieve the depth to really target those deeper pigmented areas. Let's see, looking for a sunscreen that has some infrared protection, because infrared protection does help that inflammation in the skin, so trying to find that ingredient in your sunscreen is going to help as well. But most importantly is using that sunscreen so you can help preserve your asset after you've done different chemical peels and facial procedures.
The next question is from online. It says, should children come in and get screened for cancer? Skin cancer.
So, again, it's the same thing, that not every child should be brought in. It really depends on their genetics, their family history. If they've had a family history of skin cancers, especially melanomas, and they have moles that need to be evaluated, it's always good to bring them in and do a baseline evaluation. Have them come in, we can map their moles, take photographs, and just have a baseline. And then depending on what they look like and how significant their family history is, maybe get them in every year, every couple of years. But like Michelle said, it's important to talk to the parents, like you really need to watch their moles, do monthly checks, look for the evolution of the moles, and see if they're changing. And if they do, then bring them in sooner. But we see kids, like newborns can come in, can have moles that need to be evaluated. We rarely can they have skin cancers, but it happens. So I wouldn't say, oh, they don't need to come in until they're 5. If they're that young and they have moles that need to be evaluated, bring them in.
So I'm pretty fair-skinned, and my kids are too. So one of my big questions is, how do you balance getting a good amount of sun exposure so you're getting vitamin D absorption, which helps with so many other health issues, versus covering up with sunscreen, which, I'm super fair, my kids are too, we do almost every day. What would your recommendation to me be as a mother and, for myself and my kids?
You want me to answer that one?
You can go.
All right.
You can start and then I'll pick up from there.
Well, there's a lot of controversy about that because it's important to have vitamin D, and there are benefits from the sun and ultraviolet light. We need it. We need it to convert vitamin D to its active form so that it helps us with calcium absorption for strong bones and cellular functions. So vitamin D is very important. We don't want to, the sad thing is that most of us who live in Florida are vitamin D deficient. I'm vitamin D deficient. You wouldn't think that is true, but it's true. So you have to balance it. If someone has a high risk of skin cancers, you want to really protect them. They need to have some sunlight. You need to get some vitamin D. But sometimes it's so important not to have sun that you almost say, I'd rather you have a little bit of vitamin deficiency and take, or I shouldn't say have vitamin D deficiency, but take a vitamin D supplement and get it that way rather than risk having the ultraviolet light exposure. So it's a balance. I tell my patients, I'm not saying don't go in the sun ever. You don't want to be a monk. Get some sun. They say that 10 to 20 minutes a day is really healthy, but just be reasonable. Everything in moderation. Everything in moderation.
Can I add to that then?
Yeah.
So my kids are in the pool all day in the summer.
Yeah.
And we have a screen. So like if they're in it at 9 o'clock, can I leave them without sunscreen for a little while and then start applying it at like 10?
Here's my line for everybody. Proof is in the pudding. If they're getting burnt, it's too much.
Yeah.
If
Okay.
they're getting a little color, not so worried about it.
Okay.
You don't want them to be tan,
Right.
but if they start seeing a lot of freckles, then too much.
Yeah.
So it just gauge it by that.
Okay.
Yeah, if they're getting burned, then that's too much. We don't want bad burns.
One of the
That's good.
follow-up questions to that, I'm sorry, was what sunscreen do you recommend for children ages 4 through 10 online?
So typically, I think the most important thing when you're looking at sunscreens is making sure that it's a broad spectrum sunscreen. So you want it to block UVA rays and UVB rays primarily. The other thing is we also recommend an SPF of 30. That gives you good coverage, and more importantly is reapplying. So you had mentioned your kids being in the pool, and as a rule of thumb, applying the correct amount. I don't think a lot of people know how much to apply. They just kind of put a thin layer, or the sprays are very popular right now. So they spray, they don't rub in. So I usually tell my patients to do a golf ball size, like 2 ounces, or a shot glass amount of sunscreen should be applied to your body. And then the other part is if you're going to be sweating, you're outside, you live in Florida, it's very humid, you go to the pool, you go to the beach, then you need to reapply more frequently. So instead of every 2 hours, maybe every 1 hour. I don't know if that's enough to answer the question.
I'd like to add to that.
Yes.
So my rule of thumb with SPFs is if you have an SPF of 30, that will give you about 50 minutes of coverage. An SPF of 50 will give you 80 minutes of coverage. And just know that it takes 15 minutes for when you apply it to be absorbed into the skin. So really you should be applying it 15 minutes prior to those times, so that way you're always covered. Because what happens is people, go to that 80-minute mark, and then they're like, 20, 30 minutes pass by, and then they put it on, and 15 minutes for it to absorb, and then 45 minutes have passed, and you've already gotten burnt. So just rule of thumb, 30 SPF, 50 minutes, 50 SPF is going to give you 80 minutes of coverage. But you do have to reapply, and also when you see those higher SPFs on the shelves, they don't actually give you longer coverage. 50 is the highest that you can go. You really, don't need to be buying or spending extra money on the higher coverage. Just, go with the 50, because with 100 SPF, you still have to reapply it every 80 minutes. So just
You're wasting your money.
wasting your money. Yeah. Yeah.
How long will lip injections take, the recovery, and will you bruise?
I'll take that question. So with any injection, I always tell patients when we come in for consults, there's always a risk of bruising. So we're humans, we have veins throughout our bodies, vessels, we bleed. So if you have an event coming up or photographs that are going to be taken, allow yourself 2 weeks before that event comes up to have the injections done. So if you don't bruise, that's a plus, but most people tend to bruise. You wanted to know the recovery time also. So kind of the same rule of thumb is typically about 2 weeks after. That's usually when we have patients come in to do a follow-up, and most of the swelling, bruising, redness, any kind of adverse effect or side effect, normal side effect, subsides within that time. So there are some patients who are very fortunate, who don't get any bruising, get very minimal swelling, who don't have any issues. But we also see patients who bruise, and they can last for about 10 days. We also recommend things like icing to reduce the inflammation, using a topical or oral supplement called Arnica that also helps to reduce the bruising time. And I've also brought patients back in and done one of the treatments that we carry, which is called IPL, to also help reduce the bruising time too.
Yeah, Michelle, we had a patient that had, well, actually, I think it was Julia.
Our office
who
manager.
had some bruising from an injection, and we did, it's called intense pulse light, and it really took the bruising away.
Within what, 24 hours, it was gone.
So if we're in a pinch, we can always do that.
Yep.
So we have a question from online. How often should I be exfoliating?
It depends on what's going on. I always say start off exfoliating twice a week, and then you can increase to 3 times a week, and it depends on the exfoliator. If we're dealing with acne, and we have actually a really good product from the ZO line called the Dual Action Scrub, you can actually use that daily if we're treating some of the acne and trying to exfoliate on the cell turnover in the skin. So it just depends on the skin type and the individual.
The follow-up to that was, what products do we carry? Skincare products do we carry?
Okay.
The best.
We carry the best, yes. So we carry the ZO line from Dr. Obagi. We also carry our Skin Medica line. We have the Skin Better line and the Aven line. So and actually we carry a couple Irrifotona, sunscreen,
Couple niche
couple
products.
niche products as well.
The best thing, kind of what we said earlier, where everything's individualized. It's not cookie cutter, one size fits all. So that's why we offer the consults to our patients to come in, meet us face to face, and really get a good assessment so we can give you the best treatment.
Because people have sensitive skin, some people that might just have photo aging skin. So we have lines that cover each type of skin. That's why it's important to come in.
And the reason why we have so many is because there are some lines that do certain things and other lines that treat other people's conditions and concerns. So it's kind of the best of the best from every part of the lines that we have that we can offer.
So we have time for 2 more questions.
Hi. How do you minimize stretch marks?
So stretch marks are tough. They're tough.
They're tough, yeah.
Yeah, so it depends on what kind of stretch marks. Like if
From
it's,
pregnancy.
so if it's from pregnancy, so if you catch them early, then a lot of radio frequency lasers can help with that. There's one that we have called Juvashape that can help. Creams work a little bit, but not great. And the stretch marks are very difficult to.
Does
to-
microneedling help?
Microneedling is also a
I
good
was gonna say microneedling will help.
tool for it. So it really depends on when you catch it, but topical creams like tretinoin, which is like Retin-A, or retinoids can help with that. Glycolic acid somewhat can help with that. But the radio frequency laser, or something called a pixel laser, works really well with that too.
Okay, and because for me, when I was pregnant, I didn't notice any stretch marks. But I was applying, just some product over just to make sure that I was somewhat preventing it. But then after I'd given birth, that's when I noticed it. And I would continue to use the product, but I just felt like there was no, reducing any of the lines or anything like that.
They're tough. I mean, there are a lot of people that say that they can help with stretch marks. They're called stria. And honestly, because what happens is it's a alteration in the elasticity, the elastin and collagen fibers, and sometimes that's not reversible. And over time it does fade. That's the other thing. It's reassurance, because they start off red or brown, and then over time they get back to more skin color, so it doesn't look as noticeable. But those things that I talked about can help kind of make that process quicker.
Thank you.
Mm-hmm.
I'll ask. How does diet impact your skin?
So diet, it's a tough question. I could spend like
A lot of time.
a lot of time with that. It really depends on what you're talking about. So if patients that have chronic inflammatory conditions like acne, for instance, psoriasis, autoimmune diseases, eczema or atopic dermatitis, everybody's different. Everybody's affected differently by the foods that they eat. But what I tell my patients is you are what you eat. So if you have higher amounts of inflammation in your body, you don't want to eat foods that also add to that inflammation, such as processed foods, processed carbohydrates, sugars, white breads, things like that. So you really want to cut down on those things that will lead to more inflammation. Acne, for instance, it used to be, they did studies a long time ago to see if like pizza or Coke would influence acne. There wasn't anything conclusive. There's some recent studies that have shown that it indeed does make acne worse, and I think we put that on our Facebook feed. It was a study that they just did. So diet is very important for your skin. We need the nutrients, the vitamins, the antioxidants, and our cell is just like our skin is like every other cell in the body. It needs those proper nutrients in order to be the best it can be. So that's kind of a glossed over.
We have another question online. Does your center and your office do men's hair removal?
Yes.
We do.
Yes, we do.
So we carry the light shear laser hair removal. We treat men and women. So again, anywhere from head to toe. There's patients who come in. Best thing to do is come in for a consult. We can talk about the area, see your skin type, go over what your goals are. But yes, we offer that.
As long as the hair has pigment in it, like it won't blonde, it
red.
will not. Red is not very good. It may be a little bit. Gray, unfortunately, does not.
You gotta catch it in
Yeah,
time.
gotta catch it in
You gotta
time.
catch it in time.
Yeah. So as long as the hair has pigment, then we can treat it.
Okay.
Alright.
Stand in front of him.
Stand in
Okay.
front of me.
So our time is up for this evening, so we thank you for joining us. For any of you that ask questions online, we will respond privately to you. So then we invite you, if you'd like to make an appointment with us, to call us at 941-907-7372.
Thank you very much,
Thank you.
everybody.
Thank you so
you.
much. Have a good night.